First, the mRNA is injected within lipid nanoparticles in your arm. It travels to every organ system, including the heart. And there's two papers, one by Ballmeyer and colleagues, one by Crossan and colleagues. Crossan found mRNA directly in the heart of deceased mRNA recipients. So we know it reaches the heart. Ballmeyer found the spike protein directly in the heart in biopsies of patients with vaccine-induced myocarditis. So we know the vaccine mRNA and lipid nanoparticles get into the heart, translate into spike proteins, and cardiomyocytes begin to produce a toxic non-human protein. And your own body attacks the heart, resulting in inflammation and cardiac scarring, including microscars, which are undetectable with imaging. You can only detect it with a microscope, which is very disturbing. And so once you have this scarring, you're going to have cardiac electrical abnormalities, electrical conduction abnormalities, and your heart's not going to beat properly. And then when you go exercise, we found there's two triggers, either during exercise or sports when there's exertion, or during the morning waking hours of sleep. In these two periods of time, there's a surge in catecholamines, including dopamine, norepinephrine, and epinephrine. And so during these times, when you have this cardiac damage, when you have this scarring, that's the trigger usually that leads to this vaccine-induced cardiac arrest. And that's why we saw a lot of sudden deaths among athletes back in 2021.
A person who had 4 Pfizer vaccines, and then a year after that came down with a colon cancer, and there were 3 biopsies taken, 2 before death and 1 after. The person died of his diagnosis within 30 days. Those samples were then, we used a tool called PCR to look for the Pfizer's vaccine sequence, and then resorted to a process known as Illumina sequencing, to sequence the tissue to see if there's any Pfizer sequence in there, and there is. And shockingly, there's a lot of it, and that was not expected. The only way it happens is that it got into the cells and amplified, and it started replicating.
Does it imply that it caused the cancer, or just the fact that it was present in the cancer is concerning?
Yes, it's a good question. We can't nail causality from the data we have, but it is certainly a concern when you see a sequence like that. So there are mechanisms where this could be playing a role in cancer. So the reason we'd like to get this message out is that I think too many of these tumor biopsies are getting thrown away, and the evidence is disappearing. And it's important for folks going through that process to try to retain the biopsies if they can, so that we can go back and see this is in fact the case.
And what are you all cumulatively learning or expect to learn in the coming year or two about all of this?
Well, we want to understand how long does this stuff last in patients, because this DNA was not consented to, we didn't expect it, so now there's a new question of how long does it last. We've already seen papers come out showing that they can detect nucleic acid in placentas, and there was vaccine nucleic acid in those. So these mothers, unfortunately, I believe, were forced vaccinated for the birthing center. So we don't really know how long it lasts in placenta. And if it's in placenta, it's probably getting into the newborn. So there's an ongoing question in the whole field of where is this vaccine going, how long is it lasting, and what is its contribution to disease? And we have to track the molecules of DNA and RNA to sort that out.